So one is, how do you best support a loved one who to overcome loneliness in their senior years?
Right. So I think, yeah, for many of us, it may well be that we're concerned about someone that we care about, a loved one, a relative, a friend. And I think, well, the first thing, of course, is identifying the issue. As I said earlier, it's important to talk to the person and find out how they're feeling and not make assumptions. So there are some people who are relatively happy being on their own, but if you're concerned, then obviously there's a signal that the person is not doing that well. And when you think about the mental health aspects of this, so for some people it might be increasing depression associated with being on their own a lot and not having a lot of human connection. Um, or it could be that some people are very anxious in their life. The pandemic sure didn't help, right? Because we all became, well, most of us, I think, became pretty anxious about the world around us and about, well, just about people, right? I mean, if you think about it, I remember, walking, trying to get out for walks and just avoiding people, right? You'll do anything you could to just stay away from people, even if it meant stepping out in front of cars. And you know, what did that tell us about social connections, right? It was a terrible time. And I think some people are still afraid after that, after that period of time. They're afraid to be around other people. And some people became really quite phobic about it and even agoraphobic, meaning they become so anxious they stop going out or they don't want to be around other people at all. So, but in terms of actually supporting the person, find out how they feel and find out if they do want more in the way of connectivity, and then explore with them what the options are. And there are a lot of different options. Make no assumptions because each person is so different. For some people it might be that they have just gotten out of the habit of doing certain things that have been helpful in the past. So getting them back on track again might be really important. That it's okay. You can tell them that it's okay to start doing the things they used to do. If they're really anxious about being around people, then there are other options, of course. Now, I would encourage people to actually start connecting again in person. But for some people, a virtual connectivity can still be good. So, using FaceTime and Zoom and connecting that way can still be very helpful for people. It could be that individuals need referral to community resources. So often people don't know what's around them or what's available. I mentioned befriending, which means a program that is specifically designed to provide someone with a connectivity through usually a volunteer, somebody who's willing to, say, speak weekly. There are some phone-in services. And so actually, if you do a Google search for these kind of programs in your area, I actually did it last night just to see what comes up. It's actually amazing how many programs there are. My own organization at Baycrest for many years has had a volunteer-friendly phoning program. And some of my patients have been volunteers and they really enjoy doing it. It's very good for them. That's another thing to mention is volunteerism. Volunteering can be a wonderful outlet for people, gets you connected to others, and of course, it's a wonderful thing to help others as well. So I think those are some of the things I would say in terms of helping a loved one. Spirituality, for some people, that's really important. Religion can be important for other people. So for some, it might be a matter of getting them reconnected to a church or a temple or a synagogue. But just always remember that each person's different. So you have to explore with the person what would be good for them. And then if the person's depressed, they may need, real encouragement and support in order to start making changes. Because, I mentioned earlier, we're all kind of resistant to change, and we all have our habits and can get into bad habits. But if you're depressed, you need to overcome that inertia, that lack of motivation, and that if it's really bad, it could be that the person actually needs some sort of care, treatment, perhaps some sort of therapy. If it's really bad, maybe even medication.
Thank you for that. That was a very interesting question indeed. We have another question, and they asked, with all the cutbacks at the provincial and federal level, how do you go about getting help from your family doctors or other health providers? Most of the time, it's very difficult to get an appointment with specialists, especially with all the backlogs. So, how do you do you have any suggestions on how to approach this?
Yeah, well, again, going back to the pandemic, it's put such a stress, on the health and social service systems, in dramatic ways. And we read constantly now in the media about the challenge of um, getting a family physician. So we have so many people in Ontario that don't have a family physician. And so yes, that is a very serious issue. I think the government is beginning to address the situation in terms of the urgency of it, because there is certainly a crisis in HHR, so human health resources. So we need more physicians, we need more nurses, we need more healthcare providers right across the disciplines. So, and the stress of the pandemic has led to a fair number of early retirements of both physicians and nurses and others. So, yeah, this is a tremendous challenge. I think that on the positive side, virtual care has blossomed. So now some people argue that it's been overdone, and that my doctor just wants to call me by phone now, and that's not ideal in many circumstances. But certainly in mental health, it's opened up a lot of channels, a lot of doors. So doctors and other healthcare professionals have been able to link with their patients much more readily. In terms of if actually trying to find a healthcare professional, if you don't have a doctor, for example, there is the College of Physicians and Surgeons of Ontario. You can go there and find out if there are certain doctors that are still taking patients, and usually there are some. And you can ask people if they have suggestions or contacts. I think that there are also some online resources now where you can actually phone in and get a medical consult, and some of those services charge a small fee. And certainly where most of us do not want to pay a fee in a system that's already funded. But sometimes there are community resources that we're not aware of. So I think going online and really doing searches, sometimes there are many services that are available, and it's just a matter of linking up and finding them. So with all these things, I think it's a matter really of trying to be as informed as possible and trying to get as much as you can of what's actually available.
Thank you so much. Okay, we have two questions, and they're actually about dementia. So I was just wondering, I'm just going to read them to you, and you can let us know if you're comfortable answering or if you have any insights on it. So the first one is, what are your recommendations on dealing with someone with early dementia who experiences sundowning?
Okay. Yeah, so just for the group's understanding, so the term sundowning refers to something that's fairly common, and that is that for reasons that we don't fully understand, as the day progresses, as you get into the later afternoon and evening, some individuals become more confused, more than they normally are, and some individuals can become a little bit agitated, restless, and so that's the term sundowning. And so it seems to have something to do with the kind of daily rhythm of life, so the 24-hour cycle, And so, it's important always to find out if that's a consistent pattern, not something new. If it's new, then it probably should be investigated, because sometimes if a person has, let's say, an infection, then they can become more confused, and that needs to be investigated and possibly treated. But if it's just a daily pattern, in, day out, then there are various options. Now, light may be important. Again, it's this 24-hour cycle, and we actually know that bright light during the day can actually help to reduce sundowning for some people. And bright light, you can obtain that obviously by being close to a window or going outside. But for other people, there is a thing called a light box that you can purchase. They cost a couple of $100. And if you spend a short period of time, like 20 minutes, near that light, it can give you extra light. Now, we use that to help people with a seasonal mood disorder. Some people get more depressed in the winter when there's less light. And so that light box can be really helpful. But there's some evidence that may be helpful for sundowning too. The other thing is that depending how severe or significant it is, there might be some medication that could help. We try to avoid medication if at all possible in people with dementia, but there are some situations where a person might get very agitated or even aggressive perhaps later in the day, and there are some medications that we can use that can help settle the person without causing too many side effects. But like I say, that's usually a last resort. The other possibility is finding out what's going on for the person at that time of day. Could it be that they're just don't have enough stimulation? We see that a lot in residential homes or long-term care homes, and the best thing there would be some sort of activation or something that can distract the person or interest them. And often we don't have enough resource in those kind of settings, but sometimes if a person can get engaged in something that they find interesting, that can itself kind of reduce that sundowning.
Thank you for that. So we have another dementia question, like I mentioned, and this one's a little more specific. So if a dementia patient believes that a loved one who has passed is still alive, should you
Mm,
go along with belief or should you kind of pop their bubble?
yeah, that's something we talk about quite a lot actually, amongst ourselves. And it does always depend on the person. Like I say, everyone's different. I think if someone's dementia is quite severe, so that their memory loss is really profound, and that usually means they can't take in new memories, then if you tell them that a loved one has passed away, in the moment they may say, "Oh, that's terrible," and they may become very upset. But the next day they may not remember that you've told them that, and of course they always want the person to be alive, and they want that'll be their desired thought. So so it's a challenge, what we most of us think that if at the time of passing that a person with dementia has a right to know about it and should be told, and should be allowed to grieve if appropriate. But if they can't remember it and they keep asking, you know, um, you know, where is my wife? It may be that it's better to distract them at that time and not repeat over and over again that their wife has died. So I think again, it's a matter of thinking about each individual and what's working and what isn't working. But I think there's no clear answer to that. I think that, like I say, I think we think a person does have a right to know, but I think you'd also argue that it may not be a good idea to make them upset and agitated on a daily basis.